Antegrade approach is more common in Europe, and actually our colleagues in Europe did a phenomenal job teaching us how they utilize Antegrade approach and why. So we adopted it here, and in the United States right now about 30 to 40% of physicians use Antegrade approach. In Antegrade, imagine the closer you are to the source of occlusion or area of resistance, basically, your left hand on the tip of the catheter, or whether you're right-handed, it doesn't matter. Your hand to the tip of the catheter, the distance between them is shorter. And as I mentioned earlier, this catheter is all about rotating it, right? As you rotate it, you generate kinetic energy, which you can grab with the second hand, and then actually release it when you're ready. When you release it, that kinetic energy is augmented distally and allows the catheter to propel itself forward. Now the wire that is inside this catheter have a significant support from Antegrade. Physicians have more control. They can take the wire where they want to. They can even feel if the wire is gone subintimal versus true plaque. Physicians that have had enough experience don't know. And the reason I say that because this catheter allows you to have significant tactile feedback that I've not seen with other catheters. Everybody is going to think hopefully the same way, that it's actually much better to be able to approach pedal loop reconstruction in an Antegrade fashion, especially when you have a catheter that is able to transmit your kinetic energy to the tip of the catheter, allows your wire to be more controlled, much more powerful gram tip wise, but also at the same time, you can pull the catheter back and lower the gram tip as well. It's a phenomenal tool. So the BOSS catheter is sort of like the new generation of catheters, like it's ahead of its time, in terms of what it can provide. So it provides a significant torqueability, pushability, and trackability. Those three elements, in cross and tibial pedal disease, are the essential elements to be successful to safely cross tibial pedal CTOs. Going up and over sometimes is an essential component of the treatment because we're treating proximal SFA plus tibial. And that happens. This is where the combined telescoping technique of the BOSS catheters, the 035, 018 together, and soon the 014, you take them all the way down, and then when you place the 018 BOSS catheter in the area of high-grade stenosis or CTO in the pedal arteries, you're going to notice that your wire that you're using, whether it's a 1 gram tip wire or 2 gram tip wire or 3, you're going to be able to control it so well. And as you advance your wire, all you have to do now is torque the 018, and as you torque it and rotate it, it will propel itself behind that wire. And you'll be surprised, actually, as an operator using this for the first time, how nice and easy it will track behind that wire until you get to the loop. And then once you get to the loop, you just have to find long enough devices to do the rest.